Hello and welcome to a video cast from the American Academy of Otolaryngology, Head and Neck Surgery. My name is Rich Rosenfeld. I'm the Editor-in-Chief of Otolaryngology, Head and Neck Surgery, the Academy Journal. And we're going to speak today about some of the best ways that you as a reviewer can do your reviews efficiently, make them meaningful, and enjoy the process. And to facilitate that, I'm happy to be joined today by two of our best associate editors, who are the ones that pick the reviewers at our journal, and that is Cecelia Schmalbach, who's an associate editor for Head and Neck Surgery, and Mark Wax, our associate editor for facial plastic and reconstructive surgery. Something that always comes up, I think, when you sit down to review the manuscript is, how much time should this take? Should I devote a half hour, an hour? Should I write a paragraph, 2 pages, 3 pages? What's the guide? Mark, let's start with you. What would you tell people is the level of effort that should go into a typical review?
You know, I think it's hard to do a very good review in less than 15-20 minutes. I think that most reviews probably take at least about a half an hour if you're planning on typing up and providing useful information to the editor, the associate editor. One of the things that we see sometimes is where the review is so complex that it is almost more or longer than the actual article. And so I think you have to take that large view and don't get caught up in too many of the details, semantics, grammar, spelling mistakes. 3 pages delineating those, I don't think really helps in the review process and wastes your time.
You give me a little palpitations there when you started saying don't take less than 15 minutes. That's a pretty short amount of time, and I suppose it gets back to a quote from Aristotle that the level of precision and I guess effort applied to a subject should really match the level of precision that subject deserves. And sometimes a manuscript can be obviously so bad or so flawed that maybe 15 minutes could even be too much time spent looking at it. It just jumps out at you. But on average, Cecelia, assuming that it's a more reasonable manuscript, it's worthy of review, it seems to have some merits, what's the time allotments and sort of the writing amounts that you would expect as an editor from your reviewers?
Sure, I just want to echo Mark Wax's points, and usually it falls somewhere between a half an hour to 45 minutes. You ideally want your review to be succinct such that you're letting the associate editor know exactly what the weaknesses are and whether or not this is publishable, yet at the same time you want to be providing constructive feedback to help the authors learn and understand what they can do better with either a revision or maybe in their next attempt to get published. And usually that takes about a page.
So about a page, half hour to 45 minutes. I think you're getting advice from some pretty seasoned reviewers here, and I'd submit that for many, certainly novice reviewers or intermediate, that probably an hour to 2 hours is more accurately going to reflect the level of effort they might need to get the insight necessary. And the amount of writing can vary. I think the estimates you were given is very good. Very helpful to include some comments to the editor as well, particularly if there's something you're not entirely comfortable saying in the comments to the authors. With that said, Mark, before we move further, and one of the things we're going to discuss is how you as a reviewer should make decisions about the manuscript. For example, recommending or minor revision, major revision, rejection, what do these mean, and how to react if a decision is rendered eventually that's different than yours. Before getting into that, Mark, do you have some top recommendations or things you'd like to advise reviewers of manuscripts?
You know, I'm as guilty as anybody when I review.
You're always guilty. That's the problem. So this is no exception.
So even when I pass things on to the editor, I think taking that 4-paragraph commentary of comments to the authors and copying and putting it into comments to the editor really doesn't help. When I look for something or when I try and do something, I think 2 to 3 lines that really just boil it down to, this paper has a major flaw, here it is, if they can fix this, it's good to go. Or here's some minor issues that we want to see if they can get cleared up. That really provides me with the most information and allows me to integrate sometimes some very disparate types of commentary.
These are comments to the editor.
To the comments to the editor,
right,
as opposed to the comments to the author.
And it's a great point, because I think often as a reviewer you can feel a little mixed about a manuscript, and it might not be hardcore, but you get a sense that there's something wrong. And it's okay to voice that concern to the editor. Don't just bury it and provide comments that don't reflect it, so get it out. Cecelia, what are your thoughts and recommendations that the reviewers really take to heart?
Sure. Realize for the reviewers, the associate editor is always going to read your review, and as Mark mentioned, it is helpful though if you're unsure of a point or just want to make sure that the final reason that you've rendered the decision is made, that you include that to the editor or the associate editor separately. That would be the most important thing. And another comment for me as an associate editor, I find it a little bit difficult when you give a wonderful review congratulating them and then it's a rejection. So please make sure that your comments to the editor are consistent with your comments to the authors.
That's another fabulous point. It's very difficult as editors, whether it's associate or editor-in-chief, to try and reconcile a glowing review with a recommendation that then says major revision or reject. And conversely, if a decision is made to reject, yet it's nowhere apparent in any of the comments why this took place, it's again difficult to reconcile. Which brings us to the next topic as far as rendering a decision and a recommendation. And we'll emphasize at the start that what you as a reviewer submit as your suggested disposition for the manuscript is a recommendation. It's just that. There's no guarantee that the associate editor will necessarily agree, or the editor. It's a recommendation. So, Dr. Wax, starting with a minor revision. When is that an appropriate choice for a reviewer to give that disposition?
So I look at it as a minor revision is basically a manuscript that should be acceptable for publication, but has a few small issues or has a few facts that are maybe a little unclear, or there's some discrepancy in the data. There's just some housekeeping items or a few issues that that you would like to see addressed before it was accepted for publication. So to me, that would be, and they should be something that are relatively easily addressed.
What sort of rough percentage of minor revisions do you think are eventually going to go on to acceptance?
I would expect almost all of them.
I
would expect
agree.
100%, but sometimes the paper just disappears.
So minor revision means you really like it, and with a little fine-tuning, it's going to be published. Major revision's a little more problematic. So, Cecelia, when should a reviewer render a major decision recommendation?
Sure. In my mind, a major revision would entail actually changing either your statistical analysis, maybe re-looking at the group that you're studying, possibly the inclusion-exclusion criteria wasn't quite appropriate, and so it's more than just going back to the computer and making some editing changes, but rather you're actually going back to the study.
Okay.
The difference is it has validity, and if they make these changes, it would add something, and that's why it's not rejected.
And in your hands, what number of major revisions that come back and you then re-review it do you say ultimately get accepted?
I don't know if this is a little bit on the higher side, but I would guesstimate around 75% get accepted, 25% rejected.
I think Dr. Schmalbach is a very generous person. It might be more in the 50% range, but major revision means there's really a chance it's going to go on to a rejection. I'd point out that in both these cases, whether it's minor or major, as a reviewer, you need to specify your concerns in a way that the author can actually respond to them. So just giving a rambling concern about the manuscript is not helpful. It really should be point by point so that the author can respond point by point to address your concerns. And then comes the reject. Mark, reject. When do we render a rejection?
I think if there's well, if the material is not new. If I read the manuscript and I go, well, everything here has been defined, and yes, this is the largest series in the history of the world, that alone doesn't make it worthwhile. If the conclusions don't match what the data shows, or if it's unreadable. If the linguistics are just so poor that it's unreadable.
Anything else that really strikes your reject chord when you see the manuscripts?
If there are ethical concerns with respect to the relationship between possibly the authors and what they're trying to promote. And the other thing would just be a flaw in study design that even if they went back and tried to rework their data, it simply wouldn't be possible.
Okay. I think some really great tips for reviewers. We did not intend this video cast to be comprehensive, just to highlight a few key points. I think something very important as a reviewer is that if you feel you cannot complete the review in a timely fashion, or it's outside your expertise, or a little challenging, just decline, but decline rapidly. It's only fair to the authors if we can move the manuscript along and get an alternate reviewer. So that does conclude our video cast for reviewers of manuscripts on papers submitted to otolaryngology head and neck surgery. I thank Dr. Mark Wax and Dr. Cecelia Schmalbach for sharing their expertise as some of our best associate editors, and hope soon to see you apply to review for the journal. And you can do that at www.otojournal.org. Just click on the reviewer page and you'll see lots of helpful information, including an application. My name is Rich Rosenfeld, Editor-in-Chief. It's been a pleasure discussing with you. We hope to see you soon at the Journal.